Okay, hi everybody, and welcome to podcast number 20. I'm very excited today to have Dr. Deborah Spey on with me. Hi, Dr. Spey. Thanks for joining us.
Hi, Pauline.
Dr. Spey is part of the Schweiger Dermatology group, located at 315 Northfield Road, right up the street here in Livingston. I'm sure a lot of my clients and people watching recognize Dr. Spey. Dr. Spey is board certified dermatologist. You have a BA in biology from Yale.
Correct.
Right? A medical degree from Columbia.
Correct.
And your dermatology training from Albert Einstein.
And Columbia.
Right. So, well qualified. And I know you personally because I'm a patient. And the point of doing this podcast, Dr. Spey, is because I want to have the best of the best on. And I believe you are the best of the best. You are a unbelievable cosmetic dermatologist. You specialize in natural.
Yeah, that's my point.
But
my
you
goal.
That's your goal, and it's noticeable. It's a noticeable difference, but it's a natural difference. And I think that's key.
Yeah, I think the way I like to put it is that I like to do restorations, but not enhancements that would look really unnatural. So restoring somebody to how they looked maybe a few years earlier when maybe they looked a little bit better, or maybe they felt they looked better. Right.
Is that how you went into were you always a cosmetic dermatologist, or did it evolve just because you were so good at it?
It evolved because I guess I was good at it and I enjoyed it. And I guess I made it official this past summer. My practice was getting more and more cosmetic over many years, and it got to the point where it was about 90% cosmetic, and then finally I just said, you know what, that's what I want to do, and so we kind of made that official in July.
Right. I know, like I said, a lot of people do know you and they're going to recognize you, but I also thought it was important for those who don't know you to get to know you, because I think, like when I had Dr. Racanelli on, the plastic surgeon, you guys you're both the same. You're very humble, you're easy, you're approachable. And I think that's important to show people, because I think it's intimidating sometimes. If you want fillers or you want plastic surgery, it's hard to make that first step and make the appointment. So it's important that they hear you and hear what you do and how you do it and what your philosophies are.
Well, and I think it's also really important to be able to put people at their ease and make them comfortable so that they can ask all the questions that they want to ask and not be afraid to ask because they think the question is stupid, or, they shouldn't be intimidated. I want them to be comfortable. So I think that's important.
It's very important, because if they're not and they don't ask the questions, the result might not be what they're looking for.
Right. And it's really important for me to know exactly what they want, either so that I can do that, or so that I can say to them, I don't think what I have to offer you, or I don't think the thing that we're talking about is going to do that. It's because I think managing people's expectations is probably the single most important thing in having happy patients and getting a good outcome.
How many patients do you say have an unrealistic outcome that they want? Do most people come in with unrealistic views?
Unrealistic expectations? I think many people, at least at the beginning when they come in, first of all, they can be confused about, they think they want Botox, but they really need filler. Everybody's confused about what's the difference and what do each of those things do. So there's that. And everybody, the most common thing is everybody comes in and they're like, I need this. I need this. And they're all like pulling up on their face. And the degree to which they'll pull up, this much. And I'm like, that's a facelift. Go see Dr. Racanelli.
That's a facelift, right?
Right. So I need to make sure that what they're expecting from me is something I can deliver. And I do also like to, under promise and over deliver. But if somebody really, what they're looking for is improvement to the degree of a facelift, you can't get the same dramatic kind of improvements with non-surgical interventions. So you need to be very clear with your patients about what is a reasonable thing to expect, because if they're expecting something very different than what you deliver, one way or another, like it can be too much or too little, but they're not going to be happy and you're not going to have a good relationship. And we don't want that.
No, you don't want that. I have a bunch of questions too that my clients had asked you, and I want to dabble into skincare. But let's get into the fillers.
Okay.
What is the difference between Botox and fillers?
Okay. So Botox is, we're kind of using that at this very moment as a blanket word for toxin, because there are, 3 or 4 or even 5 maybe toxins out there on the market. Botox was the first one. It is still the most popular. It has the greatest market share. It is personally still my favorite. There's Dysport. Dysport is very similar, slightly faster onset, slightly, in some people, longer duration, slightly larger area of diffusion when you inject it, which can be a good or a bad thing, because if you're, close to an eyebrow in a tricky area and it diffuses further, you're a little bit more likely then to get an eyelid droop. But on a forehead, with larger diffusion areas, you don't get any missed areas because it diffuses. You inject it in one spot, and instead of covering an area the size of a quarter, it'll cover an area the size of $50. So because it diffuses further out. There's Botox, there's Dysport, there's Xeomin, there's a new one called Jeuveau that is brand new. I've never used it. But each of them has their own slightly different properties, but they're all really very similar. And what they do is they stop movement. So, and this is where I often have this discussion with people. Somebody will come in, and we can also have a discussion about when people should start these things. But if I have a 65-year-old woman come in, and she has, deep crevices here. She's got little angry 11s that are like the Grand Canyon, and they are etched in there. And even when her face is completely relaxed, they're still there.
That's a filler.
Correct, although it's not even the safest place to use filler. But yes, because Botox stops movement. She could never frown again, and those lines are not going to disappear. They will over time soften, because if you are not drawing your eyebrows together and furrowing your brow 100, 500 times a day, they will soften, but they won't be gone. So I have people who come back to me 2 weeks later. I like to check, especially a new Botox patient. I say, come back and let me see. And if you need a little zhuzh here or there, we'll do that. And they come back and they say to me, it didn't work. And I say, what do you mean? Bring your eyebrows together. And they go like this.
They can't.
And they can't at all. And they're not moving. And I said, well, you're not moving. And they're like, but I still have these lines. I said, we discussed that, right? So Botox is not filler. It doesn't fill the lines. It's not going to erase them. So that person perhaps should have started their filler 20 years earlier. So before it got really etched. And I have people who say to me, Dr. Spey, you have no lines on your face. And I do have a few. But I'm 56. I've been doing Botox since my 30s. So I don't have lines on my forehead, because they would have been really deeply etched by now, because I used to reverse commute from the city. Mm-hmm. And when I got to the office, I had not only 2 little lines here, they were red from literally furrowing on the traffic on 280. And I said, I better fix that.
And I can fix that.
So, yeah. Mm-hmm.
So you should start in your 20s, 30s with Botox?
I think it really depends on your face. I mean, there are people who, they don't furrow their brow. They don't need to start. They don't even need to do it ever, maybe, if that's not the expression they make. There are other women who have some sun damage on their forehead, and they raise their brows constantly, and they're getting those horizontal lines, and they're starting to look like a Sharpay. So I think the time to start, and it varies from person to person, is when you look in the mirror. Well, it has to bother you as well. But when you look in the mirror and the lines are starting to be there even at rest, when you're not making the expression. If you can raise your brows and then put them back down and there's no trace of a line, you don't need to do it. But if you, look in the mirror and your face is completely relaxed and you're starting to see lines even when you're not making that expression, it's time to start, because they're just going to get worse.
Okay. And how often should you do it? Does that vary also? How long it will last between patient?
It does vary patient to patient, but Botox, if you look in the brochure, it says it lasts up to 12 weeks, which is about 3 months. Now, it doesn't go one day there and one day gone. And 12 weeks does seem, to have somebody come in every 3 months seems kind of often to a lot of people. So what I suggest to them is that maybe when they start, if their lines are bad, do it religiously for the first year. And that way the lines will soften. You can train the expression out a little bit. Maybe you're not so used to frowning all the time because you can't. And also the muscles will weaken a little bit. So maybe in the second year, you can do it every 4 months. And maybe by the third year, you can do it every 4 to 6 months. So the muscles do weaken from disuse, just like any other muscle. It's just the opposite of going to the gym. We want not to work out our muscles.
Right.
And we want to get them out of the habit of doing this. So, and that's Botox. I think Dysport may last a little bit longer, and Jeuveau, I think, is supposed to last 6 months. That's the newest one.
Okay, and do you ever use them in combination?
I have, but it's not the usual practice. It's just a little cumbersome, I think.
And I'm assuming that they're all about the same price range.
They are, at least so far. I don't know. Well, Jeuveau is the newest one to the American market, and I haven't used it, and I don't actually know its pricing at all. But Botox and Dysport are very similar.
Right. Now, I know how much Botox cost. I used to order it. This was years ago. So when I hear people say they get Botox full face for $300, what could that possibly be? Are they diluting it? Are they, what is it? Is it?
Right. So I actually am not sure what people are doing, but I mean, I have my suspicions, because the truth of the matter is that a bottle has 100 units in it, and it costs over $600. So you can't do a whole face for less than maybe half a bottle. So you can't be doing it at cost and making any profit. So either they're getting black or gray market Botox from someplace, so they're getting it at a much lower cost, or they are taking their 100 units and they're over diluting it. Now, Botox comes actually as almost a powder in the bottom of the vial. It looks like a drop of milk in the bottom of an empty vial that has dried. That's what it looks like, a dry drop of milk. And you take saline solution and you reconstitute it.
Mm-hmm.
And so people are like, are you diluting my Botox? I'm like, no, I'm actually making it, because
right.
you have to make it. You have to turn it into a liquid. But there are different ways of doing that. And the original standard way of doing it was 2.5 cc's of sterile sterile saline. And then after many years after Botox became available, they were starting to maybe recommend 1 cc.
Mm-hmm.
I never switched over to the 1 cc because I found it very over-concentrated, and you could just, it's hard to control when you're injecting those minute, it's a much more concentrated, it's 2.5 times more concentrated. And then there are people who recommend 4 cc's in your bottle. 4 cc's is a very dilute, which means that when you're injecting it right above the brow, you're going to get much larger areas of spread.
Uneven,
if you're giving, and it's hard to control. If you're giving the same number of units, it's a bigger bolus of liquid, and it can spread to where you don't want it. So many people, myself included, and even Allergan still supports the 2.5 cc dilution, and that's how I do it. I still reconstitute with 2.5 cc's. And how did we get to this?
I was asking because
the cost.
Because it amazes me how people will go to somebody who in a back office and inject that in their face. You don't even know if they're qualified, and just the cost itself. I mean, you're putting it in your face.
Right. So if somebody's doing it for what should be less than the cost of the Botox, you have to wonder, like, why?
Why?
What are they using? How are they using it? Why are they offering it at such a steep discount? I think you're going to get what you pay for.
100%. 100%. No, that's important for everybody to know.
And I think another very important question for people to ask is, how much Botox do you do in a week or a month or a year? I mean, when I had my own practice, I was a Platinum Plus Allergan customer, meaning I that's how much I bought in a year, because they have tiers. So I was Platinum Plus, which means I did a lot of Botox. So lots of experience every day for 20 years. So I think that's what you want to look for. If you're looking for somebody, you want somebody who just does a lot of it. They'll have a lot of experience.
And that's what they're doing.
Correct.
You know, can you reverse it if it's too much?
No.
So it is what it is. That's why you want to see people in 2 weeks, because you can touch up, but you can't take out.
Correct. You can always add more, and my approach is always go lighter, have them come back, I check it, and you can always add a little more if they're like one side is stronger than the other, and so they still have a little lift on one brow. But if you had done across the forehead more in the first place than the brow that's perfect, that brow would have been down.
Right.
Right. So that's the story with Botox, and
And the different types.
Yeah.
How about Botox for, as we age, the frown?
Okay, so that's not Botox. You have to be really judicious about Botox around the mouth, because remember, what does Botox do? It stops movement. It doesn't fill lines around your mouth. You need a lot of movement, and you need a lot of very nuanced movement in order to speak. So you can use Botox on the lip margin, just on the very edge of the lips. There's a place you can put it down here on the jaw, which can lift the corner of a mouth a little bit. You can, if somebody has a very gummy smile and they show gum above their upper lips, there's a spot where you can put a little Botox in the corners of the nose. You cannot help these are called nasolabial folds, the ones that goes from your nose to the corner of your mouth. And these are called marionette lines, from the corner of your mouth down to your jawline. You can't really treat those with Botox because you need to be able to smile. I have a lot of patients who they come and they show me the lines here. When they smile with a really big smile, they're creating lines on their cheek. And they're like, we need to bring the Botox further down. I say to them, take your finger and put it on your cheek right there and then smile. So do you feel the muscle underneath there? If you hit that muscle, that is the muscle that lifts the corner of the mouth when you smile.
So you will sag.
You will droop it. Yes, you can get rid of these lines, but you'll look like you had a stroke. And then you're going to be drooling. And we don't want to look that young. We don't. So yeah, you have to be judicious and use the right thing in the right place. And then these lines right here at the top of the cheek are one of those places where if people expect the Botox to fix that, it's not going to be. And often they point here to their nasolabial folds and they ask me about Botox. And I said, no, that's filler. Botox, the places that you can use Botox, I think most successfully, between the brows for the angry 11s. If they are not really etched in there, and you can practically erase them. Horizontals across the forehead, you can really smooth those out. You have to be very careful on the forehead though, because too much, and what's the direction of the movement that you're affecting? When you make those lines, you're raising your brows. So when you relax that or paralyze those muscles, you're dropping them. You have to do that really judiciously, or you're going to have low brows and somebody's going to look very squirrely.
The Herman Munster look that I said to you.
We don't want that either. And the other place is you can treat crow's feet, but the true crow's feet that you can make just by squinting like this, not by smiling. So the ones that come straight from the corner of the eye and go out, yes. And in fact, that's how Botox was discovered in a way. It was used, there's something called blepharospasm, which is a spasm of the eyelids. Mm-hmm. And the eye doctors were treating blepharospasm with Botox around here. And what they found is that the people came back and they had no crow's feet. They were smooth. And that's how it was discovered.
Wow. How about the neck area? I hear people say the Botox for the wrinkly neck as we age.
Yes and no. Okay, so Botox can be used in the neck. Botox is not used for the things people think it's used for in the neck. It's used for a ropey neck, that cordy neck. Like, see these? When you make those, like the tendony neck, like that? You can inject Botox into those tendons and then relax it, and you'll have a smoother neck. However, the amount of Botox that it takes to effectively correct that problem is it's a lot. It's a lot of Botox. And it gets very close to the amount of Botox where you start seeing a lot of problematic complications, like inability to swallow. And if you can't swallow, you can choke, you can get an aspiration pneumonia, you can die. There have been not a single death from Botox used above here, above on the upper half of the face. There have been problems below there. So you know what? I just don't do Botox in the neck. It's probably a great technique, but for me, wrinkles, death, death. I'm not doing. It's not worth it.
And there's probably other things that you can do to tighten that area, or bring the youth back into your neck that we can talk about too. Mm-hmm. Let's get there, but I wanted to also talk about the fillers.
Okay.
Because to me, and I could be completely wrong, the fillers seem a little tricky because the lines, the folds that we were talking about, sometimes I think if they're too smooth, it's not a good look.
People look puffy.
I'm seeing that. Is that what?
Yeah. People can look puffy or artificial because at a certain age you are supposed to have, like an adult will always have a demarcation between their cheek and their upper lip area. This groove. Now, how deep that groove is and how aging that groove is, that varies. I'm desperately in need of fillers myself right now, but so I have a little of this going on and a little of this. This is a good candidate for fillers. And there's different ways to approach fillers as well. We now have 2 ways that we can approach this. Actually, there's 3 things that I have in my bag of tricks to approach this line. You can, it's not the newest filler, but it's one of the newer fillers. It's not the one I often start with because it takes people a little bit of trust and a little bit of faith because they don't usually come in asking for that. But the reason people get a line here is because they've lost volume in their cheeks, and they can lose volume, bone volume, fat volume, hyaluronic acid. The skin itself is thinner, and so when you lose the volume up here in the cheek flattens and then it sags and it comes down and it creates this line and it creates this line and it creates the jowl, and all of that is from this sagging, from volume loss in the cheek. So I think often the most natural way to correct that is with Voluma, which is the proper name is Juvederm Voluma. So it's a version of Juvederm. It's the most fluffy, volumizing form of Voluma, and you put it up here. It can't go in this hollow. It has to go on the bone.
And it will lift.
And it is probably the only filler that actually lifts up towards the ceiling. All fillers will lift this way, like into the room, like make the lines less deep by lifting the bottom of the line. But Voluma actually, because it has this odd sticky quality, if you lift while you inject it, it doesn't fall all the way back down, and you actually get a lifting. And also by restoring volume, you get a lifting as well. So you can get quite a significant improvement in this line and this line and the jawline simply by restoring volume in the cheek. And I have women who come in and their cheek is sagging and it's practically rolling over. And when it's rolling over like that, it's really hard to just try to put filler here and correct it because you still have that cheek almost in the way. So the best thing is a little Voluma, lift the cheek out of the way, and then fill what's left. And often you can get away with a lot less filler in this area and a much more natural looking correction because you're actually going to the cause of the drooping.
See, that's why you need to go to somebody who knows what they're doing. That's interesting. That makes so much sense.
Correct.
Have you ever turned somebody away because they've had too much? They've gone somewhere else and came in and they want it more and more and more, and you just said, that's enough?
Yes, and she didn't want to wait for the appointment to see me. She went elsewhere. She was very unhappy. She went back to him. He added still more. She was, of course, even more unhappy, and she came to me and wanted to know if I would dissolve it because hyaluronic acid fillers are technically reversible. But what I will say is we don't reverse them just because you don't like it, because the reversing process is not as simple and straightforward as you would think. And I'm not going to reverse someone else's filler because I don't know exactly what the filler was.
Go back to who did it.
where they put it. I don't know any of that. I am not wading into that. And the good thing about the fillers, they go away. So I said, wait, just wait, and then we can address it when it goes down. But she actually came in every few months and said, can we do it now? And I'm like, not yet. Right. So she kept asking, but there was already too much filler in her lips. And I was like, no, we're not putting more, because more is not the answer. You actually have too much. In the wrong places.
So it was in her lip area.
It was above the lip, and she had a little of that going on.
Oh my God, that would be horrible.
You see it a lot, though.
I see it a lot.
Yeah,
I see it a lot.
Mm-hmm.
And the younger girls too. Sometimes I don't know where they're going, but it's too much.
Yeah,
way too much.
It's not pretty.
It's not pretty.
It's not pretty, and I have to say, these young girls, they come in with beautiful lips, just beautiful lips, and they want more. And what I caution them is that if somebody, on a scale of 1 to 10, somebody comes in with lips that are a 9, it is, and they are a God-given 9. They were born that way. And we start messing around with them, they're as likely to wind up at a 7 as they are to a 10. It's hard to get from a 9 to a 10. You mess it up even a little bit, and they're at a 7. Like, leave your beautiful lips alone. Those you were born with them, and they're natural and they're beautiful. The
girls nowadays are just, it's all about the lips. What's the youngest you'll take a lip injection?
I think it depends on the lip. You know, if somebody came in and she was 26 years old and she really, I thought, had really small lips and could use a little bit of enhancement there, I'll do it. But as I said, I'm much more about restoration than enhancement. I had a 28-year-old come in and she absolutely hated the cleft in her chin. Who hates a cleft in the chin? I thought it was sexy, you know, like she had this cute little cleft in her chin. But she said, no, it looks like a butt.
Interesting. It bothered her.
So it really bothered her. So, okay, I fixed that for her. And I was remembering the story of when I was at camp as a kid, there was a co-camper, a boy, who for years I didn't even know his real name. His name was, as far as I was concerned, Tush. Everybody called him Tush because he had such a deep cleft in his chin. So I told her that story. I don't think she found it very funny.
How about an 18-year-old? Believe it or not, my daughter tells me there's high school kids getting lip injections.
I don't think I've ever done a high school kid. And I think I'm not even sure I've ever done a college kid. I think out of college is more reasonable. I have done some laser hair removal on the younger female patients, because sometimes it's just really making their life miserable if they're a little precocious in their development.
And I understand that. I mean, back when I was growing up, believe it or not, like my mother, I don't know if it was just because of the Italian background, like it was torturous to even have them let you shave your legs. And I look back and I'm like, why? What is the difference? I guess they had that. The sooner you start, the worse it's going to be.
It's not. It's not. It is what it is. And I think the youngest I've ever done a bikini, I think I've done, trying to remember, she was 12, 13, maybe 14. One was a swimmer and one was a gymnast. And these poor kids were a little precocious in their development and shaving themselves raw. And the gymnast, when her coach would get up and help her, put her legs out on the balance beam, she was just mortified. And she had, this kind of prickly skin there and irritated. And so you can really make somebody's life better for them.
And that's when I agree you should do it.
Mm-hmm. Absolutely.
You should do it when it's really bothering you.
Yes, I will say that the laser, the hair laser, works better. I wouldn't say better, but works in fewer treatments.
When you're younger?
When you're older.
Oh, when you're older. That's interesting.
On patients over 26, and it's because until you may look like a grown woman, but until you're about 26 years old, you don't have all your hair. So you can't eliminate all the hair. And so every year you're going to get a few new ones, usually around the edges as the area, like as the underarm area or the bikini area gets bigger. So you get a few new little hairs at the edge. It's not a reason to not do it, but it's something that I'm very clear with both the patient and the mom. And they always forget. And after, 7 treatments, the mom will be like, I was so done. Why is she not done? I said, remember, she has 85, 95% reduction of the hairs that she came here with, which is done. I consider about 95% reduction done. You can't always get 100. But she's still getting new hairs. So you can't kill the ones that aren't there yet.
Interesting, right? You think it would be easier on a younger person.
Like, and also the reason you can't get to 100% of the hairs sometimes is because you would think that softer, finer hairs go away more easily, but it's the coarser ones that go away more easily. So the darker and coarser the hair, the lighter the skin, the easier it is to get rid of it. And so as you go along, eventually you're faced with kind of these few very soft, fine, sparse hairs, and sometimes you kind of almost reach a plateau.
Okay. Is it painful to do laser hair removal?
It's not fun.
It's not fun.
No, I mean, we have some topical anesthetic in there. Then the machine itself sprays some coolant. So they're all things that we do to make it more comfortable, but it does hurt a little bit. I mean, it's momentary. It doesn't hurt later.
Yeah, see, listen, if you can get waxed.
It's about the same as that, probably.
Okay. Right? You think? Really?
Some people say it's not even as bad as waxing. I think it really varies body part to body part.
Yeah, the sensitivity of the area.
Correct.
Okay, that's interesting. That's good to know, though. Can we talk about skin tightening? What you offer as far as skin tightening? Because that's a big, huge thing with my clients after their weight loss. They have areas that they want tightened. Okay,
so skin tightening. I'll start with skin tightening because I think I'm not sure we finished our conversation even about filler. Remember I said there are 3 things that you can do about these areas.
Oh, yes. Okay, so, let's go back to
so that. One was Voluma.
Right.
One is Juvederm, but there are some other new fillers that we can talk a little bit about too. And those would go directly in here, in these lines. And then the third thing that I will mention that we can do, which is often the first thing that I actually do in order of treating a patient, is I have a skin tightening device called a Titan. And the nice thing about the Titan is it is painless. There is no downtime. And you literally leave the office looking a little better than you came in. It's pricey, but it's also long lasting. So it'll last technically, 3 years or so.
Really?
So yes, but the improvement is small, but not insignificant. It's about 3 millimeters of tightening. So remember the people who I said they come in and they show me this, and I'm like, well, we can do this, but not this.
Right.
So yeah, I can't tighten by 1 centimeter, but I can tighten by 3 millimeters, which for lines here and here, it can be not insignificant. So yes, so there's the Titan. Now the Titan device can also be used on other body parts. I generally don't present it that way because I think 3 millimeters of tightening is very significant on a face. It's hard to see on a stomach or on thighs or whatever. So I don't generally advertise it or present it as an option for treating bodies.
Okay. More for cheek and maybe neck area? Did you do neck?
When I use the Titan, I almost always treat from the crow's feet all the way to the collarbones.
Oh, wow.
And you get a lift here, the whole neck, everything looks a little bit better. And you get some of the improvement immediately because you get some shortening of collagen fibers. So it tightens the skin immediately. And then over the next couple of months, because skin over the age of 35 has the capacity to make collagen if you provoke it, but basically it doesn't make a lot of collagen just every day. But this device tricks the skin into thinking it's been wounded, and that's the provocation, and then it will go ahead and make collagen. So your skin will, over the next 2 to 3 months, make new collagen, and so your skin will even look like younger looking skin. When it's acting like younger skin, it looks like younger skin.
That's amazing, and it may be costly, but it sounds like the long term that it lasts.
It's a nice treatment, and I often like to start with it because then once you've tightened a little bit, then you do a little Voluma in the cheeks and you really get this nice, because sometimes if it's so saggy, you're not pulling up as much, but if the skin is a little bit tighter, you get a nicer lift. And then there's sometimes so little left here that you don't even have to do it, or sometimes instead of needing 2 syringes, they get away with one, or instead of using a whole syringe, they need only a half.
That's pretty cool. I've never heard of that. Tighten.
You've probably heard of Thermage.
Yes.
Thermage was the first generation of skin tightening devices. I wasn't that impressed with the Thermage, and I also thought it was more painful and had not as good a safety profile. Then they came out with Titan, and so I've had my Titan now for actually many years. And then there's Ulthera, and Ulthera is probably one of the newest of the skin tightening devices. It works with ultrasound. It also more painful, riskier. What's interesting about Ulthera is some people, when they have an Ulthera treatment, they literally look like they've had a facelift. They have such great tightening. I can't compete with that. The Titan doesn't do that. But I've seen other people and it looks like nothing.
They could have done the Titan.
There's a big range there in the Ulthera. I think the Titan is quite reliably about 3 millimeters. So that's the story with that.
With that. And so, and is there any other filler that you would recommend for here, or is that pretty much?
Well, here I usually use Juvederm. There are 2 different Juvederms. There's Juvederm Ultra and Juvederm Ultra Plus. The Ultra Plus has a little bit more oomph. So if someone has really deep marionette lines, I'll usually use Ultra Plus there. But you can't put the Ultra Plus in the lips. So if someone comes in and they have nasolabials and they have marionettes and they want a little in the edge of the lip, or they have some little radial lip lines, then I'm going to use either regular Juvederm, because it's a very all-purpose product. There's a new product called RHA3, which also you can use that same way. You can use it here, the edge of the lip, the little radial lip lines. And if somebody says to me that they just really have a lot of small radial lip lines, or these kind of whiskery lines that they get out here, sometimes even those cheek lines.
I've seen that, yes.
RHA2. So the RHA fillers, they're by a company called Revance. They have in Europe RHA 1, 2, 3, 4, 5, and I think 6. We only have 2, 3, and 4 in this country so far. But the 2 is beautiful for these very fine lines. And I like that product a lot. It's very forgiving. It integrates very quickly, so you inject it and you kind of go like this and it's gone and it's there, and it's, I mean gone in the sense that you don't feel it under the skin anymore.
Now, is that the same kind of lasting reaction, like 3 months? Are they saying 12 weeks for the fillers?
Oh no, fillers last, depending on the filler, 8 to 12 months, 12 months, 15 months. The RHAs are reportedly lasting 15 months. I haven't even had them that long yet. They're new, so I can't tell you from personal experience, but they supposedly last up to 15 months.
That's wonderful.
So fillers are pretty long lasting. It's only the toxins that are so short.
And yeah, and the same, the Dysport and all of that is the same also. I don't know if we had mentioned that.
Dysport might be
a little bit longer. You said
16 weeks instead of 12. I'm not sure I've actually really seen that, but maybe 15.
Okay. No, that's great. I wanted to also talk about skincare.
Shoot.
A lot of my clients were asking, can you please ask Dr. Spey, what's the routine? They only want to do 2 steps in their routine with skincare.
All right, 2's a little challenging. Do we have
that's cleanser and moisturizer, really.
I was going to say, do we have to count cleanser in there, or are they already clean?
Well, that's the other question. They said, do you really need to take your makeup off at night?
Absolutely. Come on, ladies.
I know. They don't want to do it. They don't want to do it.
Okay, so.
I think the older you get, the less patience you have for it.
True. But let me just say that we're going to talk then about the fewer products. If you want a very simplified routine, then what you need is multitaskers. So.
What are the most important then? I
have a favorite kind of, and I'm sure all of my reps are just gonna be so upset, but I've sold it in my office for 20 years and I can't sell it anymore because apparently Exuvian is not letting people buy their products to retail them. I think you can still get it at Sephora or Ulta or Amazon or whatever, but one of my favorite cleansers is something called Exuvian. It's not necessarily the perfect cleanser for everyone, but it is a really excellent cleanser for a lot of people who especially don't want to do 6 million steps, because it will clean your skin. It will get pretty much all your makeup off, and it will leave your skin not so dried out. You don't feel parched and tight, like, that feeling.
Oh, yes, that's the worst.
In one cleanser, and I love it particularly for like teenage girls who are breaking out, and because it gets their makeup off, because they're just going to break out if they sleep in their makeup. So it gets it off, and it doesn't leave your skin so parched that you can't tolerate your acne medication.
Mm-hmm.
If you're so dry, you can't tolerate, because a lot of them are using some of those really drying acne washes with salicylic acid, which is a great active ingredient. But if you start doubling it up with some of the drying acne prescription medicines, they're just chapped, and then they burn and they sting and they don't look any better.
No,
so
they
you
look
need
worse a lot of times.
Yes, so you need to give them a cleanser that will get their makeup off and allow them to use their medication. And also, I think sometimes these teenage girls are using like too much moisturizer, or moisturizer that's too heavy, and I think this allows them to use a little bit less or lighter moisturizer because it's not drying out their skin. So I love that product. It's called Exuvian's Gentle Cleansing Cream, and it even smells nice, even though I don't always talk about products that have fragrance. Dermatologists like unscented things.
Unscented, right? Right.
Yeah.
Will moisturizer clog your pores?
Some, definitely. Some, no. If you are prone to getting clogged, then you want one that says non-comedogenic on it, because a comedo is a clog. So non-comedogenic means it doesn't clog your pores. Certainly the heavier ones might tend to clog more. My favorite very light moisturizer, we sell, Skin Medica makes one called Ultra Sheer. The price point's a little high for teenagers, even though I think it's probably a good one for teenagers. We also have a cleanser and a moisturizer that we use for a lot of our patients who are using acne medicines, and it's I think they just changed the name from Clean AC to Clénance, and it's an Aven product. It's from France, and it is specifically formulated for patients using acne medicines, be it Accutane or other acne medicines, topicals that might be drying also, and it cleans their skin without making it irritated or sensitive, and this nice light moisturizer that doesn't clog them up, because when you're using Accutane, you definitely need moisturizer.
I mean, this all being said, we can talk about skincare, but I always find it's the best to go to go to somebody like you and find out what you really need, because I think people waste so much money.
They do, and they're buying, I will say that the products that you can get at the department store,
right,
they're as expensive or more expensive than what I have in my office. And what you're paying for there is this, first of all, like the Chanel name, or this
marketing,
beautiful packaging, or they smell and feel gorgeous. That doesn't mean that they have high concentrations of effective active ingredients.
Right.
So really what you want is high concentrations of effective active ingredients in a vehicle, in a base that is not going to dry you or break you out or irritate you or whatever.
And you need to look at their skin and see exactly, most people don't know what they need.
Correct, and not everybody needs the same thing. So, yeah.
I will tell you, I got a neck cream from you. It's the best. Mm-hmm. I left it in Miami. I have to come and get another one.
Okay.
But it's great. I have to say it's great.
So, interestingly, I used to tell you the history of that neck cream. We originally carried a line called Revision, and Revision made a great neck cream. And it was mid-priced, mid to higher priced. And then we have a company that we did some private label with. And so in my old office, I found a neck cream that I thought was just as good as the Revision, if not better. And they made a neck cream, and so I put my name on it, and that's what we sold. And Schweiger actually private labels from that same company. So the neck cream that we now have, that's called basically the Schweiger neck cream, is the same as my Advanced Dermatology, we used to call it Necklatage, but it's the same exact product from the same company, just private labeled with Schweiger's label on it instead of mine. And so that's the story. I have patients who are like, no, I want yours. I'm like, it's the same.
It's a great neck cream.
It's a great neck cream.
It really is.
Yep. I think there might be one better product on the market, and it's probably the Skin Medica's called Neck Correct, and it's brand new. I don't even we just got it. So, in terms of good, better, best,
That's the best.
the one that we have, the Schweiger one, better.
Mm-hmm.
Probably Neck Correct, best, but very different price point.
Okay.
Probably twice.
Yeah.
So because.
But will you get the same results using the best?
I think you probably get results a little faster maybe with the Skin Medica. But hey, if you have found something that you like that works for you.
Oh, I think it's great.
Yeah, if people have something that when people come to me and they ask me about skincare, I say, bring me your stuff. And we lay it out. Yeah, we lay it out and we look at it and I say, is there something here that you adore? And they're like, oh yeah, I like, okay, well, let's stick with this. Unless I hate it. If I hate it, I'll tell them I hate it. But if I don't have a problem with that, then I look, and you were asking me about the biggest mistakes people make.
Yes.
The biggest mistake I think people make with their skincare is, first of all, they started out with, they've often been using the same thing since they were in high school.
Like the Clinique.
The yellow, the dramatically different moisturizing lotion, that gross yellow stuff in the square bottle, that should all be thrown out. And the reason that we all used that is because we all got it in our little freebies, the gift with purchase.
Absolutely.
And that's how we all started using it.
That's absolutely true.
I don't know anybody that's a good product for.
Okay.
So if I saw if that were the favorite product, I'd say, no, we're not doing that. So the skincare routine usually has sort of grown in this haphazard way, just by what you happen to have come across. And so people, by the time they come to me and they're 40, they've got, a cleanser that might have been good when they had acne. They've got 3 exfoliators.
I wanted to talk to you about those.
The wrong moisturizer, no antioxidants, and a sunscreen that I don't like. So I'm like, you don't need 3 exfoliators. All that's going to happen if you're using all of these exfoliators is you're going to be irritated and you're going to look like a red shiny tomato.
Right.
We don't want that. So I sort of try to rationalize their routine. You need a cleanser. You may need a treatment product or 2. And that includes antioxidants and exfoliators. And you probably need a moisturizer and a sunscreen.
Everyday sunscreen. I don't even think that should be a step. That should just be somebody's.
Well, cleanser shouldn't be a step. Now I can get you down to 2.
Exactly. Yeah, women don't. It's amazing to me. Yeah. But even if you have the best skin products, I also think, which I have to make the appointment, the Hydra Facial. Because I've done research on it, because I tend to clog. My pores tend to clog. You're not really, to get all of that out first and then have a great skincare routine, correct? Am I wrong?
Yes. Well, the Hydra Facial does a number of things. First of all, it's not a hand facial where it's, mostly cleansing and massaging, because maybe an older woman who's very dehydrated needs a lot of massaging of moisturizer and hydrating and stimulating of the skin to make more oil. Most of us don't really need that yet. So the Hydra Facial, first it cleans, and it cleans the surface and gets all of your makeup and stuff off. Then it actually gently exfoliates with a combination of something that's a little bit microdermabrasion like, and also like a gentle peel. It has a little glycolic that it puts on and then takes back off again. Okay. So it cleans, it exfoliates. Then once you're cleaned and exfoliated and your skin is sort of softened and primed, it has vacuum, and it literally vacuums out all those blackheads without having to do manual extraction, which I think can cause some crush injury and make people get inflamed and scabby. So it sucks all those clogs right out in a very effective but gentle way. And then at the end, it sort of super hydrates the skin. And so it leaves your skin clean, exfoliated, hydrated, all the things that you would want before you start putting on any other product. Also, there's the opportunity to add boosters to it. And there's one booster called Brighten All, which is for lightening brown spots or pigment. And there are other ones that are for fine lines. They give a little puffing and help obscure fine lines too. So it's really a nice thing to do before if you had a special occasion coming up and you really wanted to optimize the condition of your skin.
Is there any downtime with it? Are you red for a day or two, or not
It
really?
might be red for a day, but really not so much. It also comes with some red light, and the special red light that you literally hold takes down a lot of the redness before the patient even leaves.
So what's the difference between that and the microdermabrasion?
Microdermabrasion is just microdermabrasion, and in fact, in our office, we have something called a Vibroderm machine, which is different than the classic original microdermabrasion, because the original microdermabrasion, the wand would spray aluminum oxide crystals. So it's a little bit like sandblasting, where you would spray this stream of crystals at the skin and it would exfoliate by doing that. So sandblasting. But who wants to be breathing aluminum oxide? So the next generation of microdermabrasions were crystal free. So ours is called a Vibroderm, and it's a textured paddle, and it vibrates and it exfoliates that way.
Okay.
But it's just that. There's no peel. There's no hydration. There isn't that as well.
So I just want to be clear, with the microdermabrasion, you said it's like an exfoliating, but exfoliation does not necessarily unclog pores. Am I right?
Correct. No, it doesn't,
I think
because
that's a misconception with a lot of people.
it can allow you to unclog better, because you've got this pore here and your clog is down just below the surface. If you have a whole lot of dead skin and debris here, then it's really much harder even to get at it. If you exfoliate that off, then you actually might be able to either suck it out with the Hydra Facial, or extract it better. But it doesn't get rid of it all by itself, because you're just on the surface,
Okay.
and the clogs are below the surface.
Okay. That's interesting. No, I can't wait to do mine. Cannot wait. Under eye circles.
Under eye circles, so many people come in and ask me about that, and really I don't think that there's a procedure that I have to offer for under eye circles.
What causes under eye circles?
A lot of things, actually, and so it
Allergies.
depends on what's causing them. So first of all, people say circles. Some people mean puffiness. Some people mean bags. Some people mean pigment. So sometimes it's pigment, and especially if you have slightly darker skin, you can have quite a bit of pigment under the eye, and so it will make dark circles. Some people have deeper set eyes, and they think they have circles, and what they have is shadows. Some people have very, very light, very translucent skin, and what they're seeing is literally their skin's so transparent that you're seeing blood vessels right through, and so it's like this bluish. So is it blue? Is it brown? Is it pigment? Is it just blood vessels? Is it shadow? What is it? So depending on what it is,
Right.
you have to know that before you're going to try to fix it. But a lot of people just do have some pigment, some puffiness. One of my favorite lines of skincare products called Isden, which is a newer line to this country. It's been here for a few years by now, though, out of Barcelona, and they have a eye cream called Chaos Eyes, and it is the best eye cream, I think, for circles and puffiness. And I think most of the patients to whom I recommend it think it's amazing.
Really?
And they just actually changed the packaging a little. The tip now is this ceramic tip. It used to be like a little tiny pump and you put it on. Now it has this ceramic tip, which is always cold. There's something about it that it's always cold. So when you put it on,
Soothing.
it's very soothing, and it might even take down some puffiness just by the cold.
Yeah, so again, it's best to be evaluated to know why you have the circles, to see if the creams will work or not. Because again, you're wasting money.
Yeah, Isden is a fascinating company, and all of their products are these kind of interesting niche products, and they all have some kind of special thing that they do. So they have the Chaos eye cream. They have something called Melatonic, which has some melatonin in it and allows your skin to rest and rejuvenate overnight, and it has a lot of antioxidant in it, and it has something called bakuchiol in it, which is almost like a little retinol, but much gentler. So it's another one of my multitaskers. It does a
Mhm.
lot of stuff. I can't really use retinols. They're too irritating for my skin, but that one's great. And then just before I came here today, I put on a product called Instant Flash. And Instant Flash comes in a little ampule, a little glass ampule, and you literally snap it open, and there's enough in there for a couple of applications, and you put it on, and it literally makes your skin have this kind of dewy glow to it, and it tightens a little bit for about 8 hours. So it's like
Oh,
magic for Zoom meetings and for this
podcasts.
podcast. There you have it.
So
I have one for you.
you do? Oh, thank you. I'd love to try it.
I'll
And you
give
can,
it to
people
you.
can get it at your office?
We need to order it. We have some testers of it, but we don't have the stock yet. But I can tell you how to get it too. But I should just get it at the office.
Yeah, you should. You absolutely should.
Mm-hmm.
And how do you say that is
It's ISDIN, all in capitals. ISDIN.
Okay.
ISDIN, and they make a fabulous body lotion for that. It's a little bit exfoliating. So if you tend to be not just dry but even a little scaly, it's great. ISDIN was founded in Barcelona. It's two families who's founded and I think still own the company, and at least one of them, maybe both, were fragrance families. They originally were in the fragrance industry, still probably are, and so a lot of their products have a really delightful scent to them. If you don't like scent, probably not the line for you.
That's very interesting.
Mm-hmm.
Very interesting.
Mm-hmm.
What is, not to put you on the spot, and if you can think of it, what is the biggest fad that for skincare that you found in your practice that you heard people doing or spending a lot of money on that was just such a hoax?
Topical collagen.
Topical collagen.
Collagen is a ginormous molecule. It doesn't penetrate through the skin. A lot of the things that we do that are sort of anti-aging, we are trying to stimulate the skin to make collagen. Because remember what I said, over 35 doesn't make it regularly, but if you provoke it, it has the capacity to make collagen. So whether it's peels or microdermabrasion or even the Titan, all of that stimulates collagen production. So you want to stimulate collagen production because the skin has to make it, but you can't put it in from the outside.
Okay.
That having been said, my other favorite multitasker is a product by Skin Medica it used to be called Tns Essential Serum. Now it's called Advanced Plus. And Advanced Plus it's a double pump. You push down two sides has two little holes and two products come out on your hand. One is clear and one is white. It used to be the original one, the Essential Serum. One was orange and one was kind of beige, and it kind of had a funky smell. And it was because it had such a high concentration of growth factors that it smelled a little like socks.
Oh.
Yeah, it was not so pleasant. It didn't stick. Like the scent just dissipated, but it was not great and it was a little sticky, and people either loved it or hated it. It had a cult following, this product. But they've now this year come out with Advanced Plus, where they redid the whole product. They still have all those growth factors, but now it's white on one side and clear on the other. So odorless, colorless, it's less sticky, it's even more fantastic than it was in the first place. And the two sides, one side, growth factors. These are really helping to tell your skin to make collagen and also giving it all the stuff it needs to make that collagen. And then the other side is pretty much everything else that your skin needs. So antioxidants, vitamin A, vitamin C, peptides, green tea, all this stuff. There's a story behind how it was originally formulated. And because originally they made something called TNS Recovery Complex, which was just the smelly orange part, all by itself in a pump, and it was growth factors. And it eventually got a cult following because it works. Things that work will get a cult following. It worked. But the company went back to these women who were using it and they said, what else are you using? And they were like, oh, well, we're using this antioxidant and that, and we're using peptides, and we're using this and that and the other. And they said, and they added up all these layers that the women were putting on. And when you put on 6, 7 layers of different things, one on top of the other, you're diluting everything. You're making mud on your face, and it's not that effective. They said, and spending a fortune, these women were spending at least $1,000 on all these other products too, plus their essential recovery complex, which isn't cheap. And so Skinmedica said to them, how would you like it if we made your life so much simpler and we put all this into one product? So they took the list of all the things that those women were using, and they put it on one side, and that was the beige, basically antioxidants and peptides. The other side was still the growth factors. You can't mix them because they're not stable and they'll break down if you put them together. So they were in 2 separate chambers.
Brilliant.
Right. And so then that got its following. And if you ask me about a single multitasker, that's another one. And then they just redid it and made it even better than it originally was. So
I wish that skincare lines would number their products also.
So you knew what number, in what order to put them on.
Right. So if you can have 1, 2, 3, 4, but maybe you're only doing 1, 3, and 4, but you know the order, because that I think is seriously, people don't understand what they should put on first. Like we talk
Correct.
about, we did a podcast with Danielle Terry, one of my clients who's a professional makeup artist. She works on SNL and a few sitcom TV shows, and she was saying she loves serums. I don't know so much about the skin effect, but under the makeup to get the dewy, the glow. But I said the same thing. You don't know what to put on first. Of course, you cleanse first, obviously, but what do you put on before your moisturizer, and in what order? So if they would just, all you have to do is number them. It's very simple.
Yes, I spend a lot of time kind of writing that down for patients too, because, and then I go and I don't anymore, but I used to give them a prescription. So where do you use the prescription? But the answer is cleanse, then your prescriptions, because your prescription should go on bare skin, then a treatment product, then a moisturizer and or sunscreen. That would be the order. But then if you have multiple treatment products, then how do you do that?
Yeah,
exactly.
Now, do you recommend the moisturizer sunscreen together?
All right.
Because that's another thing. I mean, women don't know these things.
Right. So that's actually a debate. It's a debate I've had for a long time with, I had an esthetician who worked with me. I adore her. She's like a member of my family by now. And she worked with me for, since 2003. And then she is, I don't want to say retired. She's not retired. She is sitting out COVID. Because the problem with aesthetics is you have unmasked patients in the room for like an hour. And there you're just, if somebody is shedding virus, they're just going to fill the room up with virus. And so anyway, so she's sitting out COVID. But so I miss her terribly. But she is the best esthetician I've ever met. And she insisted that if you combined moisturizer and sunscreen, it was more likely to clog. That was her opinion. Now, I'm not sure why that would be, but I generally respected her opinion about that kind of thing. So I will say that there are some combination products, tinted moisturizers with sunscreens, that I think are very convenient. But if you really tend to clog a lot, it might not be the best thing for you.
Okay, that's fair. Again, go see Dr. Spey and she will tell you what you need. It's a no-brainer.
Yeah, Revision makes a nice, if that's what you want, a tinted moisturizer with sunscreen. Revision makes a product called something, oh my goodness, I'm forgetting what their product is called. IntelliShield?
IntelliShield.
Oh, nope, IntelliShade.
Okay.
It is IntelliShade.
That makes sense. It's tinted.
Tinted moisturizer sunscreen. Great product.
Now, what's the SPF that you should be wearing on your face?
For what circumstance, right? So if you're going to the beach, infinity. I'm like, right, if you're really going to be sitting out there being exposed, at least a 50. They've been trying to renumber SPFs for a while to be more reasonable, make them make more sense.
Mm-hmm.
Because right now we have, low numbers and they go up to 100, and is 100 really twice as good as a 50? We don't know. So there was a movement that would make 50 plus the highest something could be labeled. But I would say 50 plus is what you want on your face if you're outside in the summertime. If you have a pigment problem, melasma, something, and you don't like that, then find something even higher, because you can find Neutrogenas that say 100 on them. I don't know that the 100 is twice as good as the 50. And supposedly the way they're numbered is that it tells you how many times longer than no sunscreen you can be in the sun. I think that there is definitely a plateauing there.
I was going to just ask you, how long do you think you can stay in the sun with, let's say you did a face SPF of 50.
Well, you have to reapply
2 hours, 1 hour.
You just have to reapply it. And I think that there is some sun that gets through them anyway. And so, yeah, is a 60 twice as good as a 30? No, but it's better than a 30, I think.
Right.
So
okay,
I just always
fair.
tell people the highest you can, because if you were to use them exactly as they were designed to be used, that means that you take a shot glass size of sunscreen and you put that on every 2 hours. Who's doing that?
No one's doing
Nobody's doing that. So your 30 isn't really a 30 anyway. Maybe your 50 is a 30.
Right? And then they're sweating and they're still not reapplying.
Correct. And one of the funniest T-shirts I ever saw, which I agree with it. Neutrogena put out a T-shirt at one point that said, 45 is the new 30, which is like a joke on the 60.
Yes,
exactly. Yes. But I agree. It really is. The higher the SPF, the better, because with the exception that we all do need a little vitamin D, nothing about the sun is good for you. Feels great. It looks kind of pretty, but it won't for long. It destroys your collagen. It destroys your elastin. It gives you spots and redness and broken capillaries. And it's just, no.
It's not good.
Sunscreen and a hat.
The sun is the most damaging to your skin out of anything?
Probably.
Yeah.
Yeah. I mean, certainly, a lousy lifestyle where you don't sleep and you smoke and you drink too much and you eat really bad food, all of that is not good. But I think the sun is sort of the worst culprit of all of them.
Right. Yeah, that makes sense.
Smoking's pretty bad.
Well, because you can tell a smoker.
Oh yeah, smoking affects your microvasculature, and so your circulation, so your skin's not getting oxygenated from the inside out. So it's bad from the inside out.
And also from the smoke laying on your skin, is that correct? Or yeah.
Yeah, well, your teeth and your lips and your fingers, just all bad.
Excuse me. You see the smoker lines?
Mm-hmm.
Yeah.
There are plenty of women who never smoked who still have those lines, and it has to do with, I think, how you use your mouth when you speak.
Right.
Do you purse your lips a lot when you speak? I think I do.
And hereditary, I'm sure.
Absolutely.
That plays a big role.
Absolutely.
Yeah. Well, Dr. Spey, this has been an absolute pleasure. I can talk to you for hours, but I hope you would come back again, because there's so much to talk about.
Oh yeah, I feel like I have more to tell you.
Yeah. Do you want to is there anything today that you want to talk about that you don't want to leave without saying?
Body contouring.
You want to talk? Okay.
So yeah, I mean, because that's the big thing now. That's
Absolutely.
a thing these days.
Listen, I was hoping. Now that you told me you'd come back, that's what I was going to talk about next. But let's talk about it now. As long as you promise me you'll come back again.
I'll tell you briefly then.
Okay. No. Absolutely.
So body contouring is, I think, something that's getting a lot of press right now too, and there was the Linda Evangelista story about how she had rebound fat where she had her.
Was it Sonobella?
I thought she had Coolsculpting.
Coolsculpting. It was Coolsculpting. Yes, it was.
And honestly, well, I don't have a Coolsculpt, so I don't do that, and I had never heard of it. I do not believe, I have a different machine. It works a little bit differently. I do not believe that complication has ever been reported with a Vanquish, which is the machine that I have. So the original fat melting machines were cold machines like Coolsculpt, and there are many of them on the market now, and they work. And they work because fat is sensitive or vulnerable to extremes of temperature. And if you take the fat and you either cool it, like the original machines, or you heat it and hold it at the temperature for a period of time, the cells will begin to die. And that is how it works, whether it's a cold machine, like a Coolsculpt, or a Vanquish, which is a warm machine. The side effects that you see from the machines have to do with what other tissue is affected by the temperature. So, Coolsculpt, you can have like a pain syndrome afterwards. It's 1 in 200, but if that's you, that's 1 in 200 is a pretty high number. The pain is because you can also kind of buzz the nerves, because nerves don't like cold. So if you also are affecting the nerves and not just the fat.
So what are you doing? You're stimulating the nerve?
You are irritating it.
Okay.
So some people, for 10 days afterwards, they wind up with pain in the area. And that's a problem when you've promised somebody they're having a lunchtime treatment, then go right back to work, and they have this debilitating pain for 10 days. It goes away. This is never permanent. But the machine that I have is a warm machine. Nerves are not all that bothered by the warmth. The side effect that you sometimes see from our machine is skin does react to warmth. That's how the Titan works. You can get a little bit of skin tightening from the Vanquish as a side effect.
That's a great side effect.
Well, there you have it. So that's that. So correct. But now the Vanquish ME, there was an original Vanquish and then the Vanquish ME. The Vanquish ME is even a little bigger applicator and more powerful. But it is a big applicator. It is, if you were to, it hinges. So it's like this, and the ends go up and down. So if you opened it up, it's literally this big and this wide. So you can do large areas.
Like the abdomen?
You can do the whole abdomen and even the sides a little bit in one treatment. But the difference between the Vanquish and the Coolsculpt is a small applicator, but you can do it in one treatment. The Vanquish is this very large applicator, so you don't have to be like, with the Coolsculpt, you say, well, where do you want to treat? Do you want to treat here? Do you want to treat here? The Vanquish is a very big applicator. It's the largest applicator in the industry. You need 4 treatments.
No matter what?
Pretty much you need 4 treatments. But you're going to get the whole abdomen and sides.
And what type of results can somebody expect?
If you're doing abdomen and sides, you can see from 1 to 3 inches reduction circumferentially.
That is huge.
Yeah. And I think that certainly people who get 3 inches are happier than people who get 1 inch, but even the people who get 1 inch are not unhappy because they were just lying on a table and it is painless and they don't have a pain syndrome after. Yeah, it's a pretty well tolerated and appreciated treatment. It is not going to take a chubby person and make them a skinny person. It's ideally designed for the person who is about their ideal size and weight, but they have this one area that's that they just can't get rid of.
That's interesting. So if you did it and you saw 1 inch, could you wait a little bit and do it again and see another inch?
You can.
You can.
You can. The one thing that we can't do that Coolsculpt is a definite advantage for is you were asking me about neck, right? So you can use the Titan to tighten the skin, but if they really have a little waddle here or a little fat, you can Kybella, which I don't do, but associates in my office do it. Or Coolsculpt has a very small applicator that you can just apply here, and so there's a Coolsculpt applicator for under there.
I heard Coolsculpt can be uncomfortable.
Mm-hmm. It can.
But if you use the Titan for under here,
the Titan will tighten the skin. But if there's too much fat there, you still have the fat. So the ideal order of things would be either Kybella or Coolsculpt, get rid of the fat, then tighten up the skin. Some people don't have fat there, and it's just skin.
And they can just do the Titan and be done.
Mm-hmm. Yeah.
That's a great thing to know for my patients too. Like they always, especially women who've had children, and they'll get down to their goal weight, but that's small. And they really don't want to stay in the program because they really don't want to lose any more weight.
Yep, they're at their goal weight, but they're not back to the shape they used to be.
So that's when
Same
Dr.
weight,
Spey
different
comes
shape.
in,
Yeah.
and then you would take care of that.
Mm-hmm.
That's amazing. And how long does that treatment take?
It's once a week for 4 weeks. So we tried to get them in 4 weeks in a row. But if I have a vacation or they have a vacation, as long as we get it pretty much done in 6 weeks, I think it works just fine. And the appointment can be, well, the treatment itself, the time that they're lying under the machine, if it's one area, is 45 minutes. But since the FDA said it's safe to use the machine for up to 75 minutes in a sitting, sometimes they'll roll over and then we'll get the love handles or the bra fat up here. And so you can do 45 minutes on your main area and another 30 in a second area. And so that would mean 75 minutes. We have them come in a few minutes before to get them weighed and measured and positioned on the table. And then at the end, we do a little brrr with a massaging machine to help increase the circulation to kind of move the fat out of there. But so it's max a couple of hours.
That is a great spot where you just said, because I hear women say that all the time. I lost the weight, but I have this area, and always in the back, and that can take care of it.
Yep, and you just have to lie still. You have to lie on your stomach. Now people are like, can I be on my phone? I'm like, well, no. The machine is radio frequency, so we think you probably want to keep your phones and your iPads. Just people need to learn to just chill
I was going to say, if
out.
somebody told me for 75 minutes, you're just going to lay here.
You're just
I'd be
gonna lie
fine
here.
with that.
Yeah, so many people complain to me. They're like, oh my God, I freaked out in the MRI machine. I'm like, oh my God, nobody could bother me in the MRI machine.
Can you imagine? No phones, no kid, nothing.
Exactly.
Yeah.
So
women need to just take that and understand and go with it.
Exactly.
Yeah. Oh, that's great. That's great. So you will come back and talk with us again.
Sure.
I thank you very, very much.
Oh, thank you.
I did want everyone to meet Dr. Spey. She's the best of the best. And we'll have you back soon.
Thank you so much.
Thank you.